It's a shot that can save lives. The vaccination guards against the human papillomavirus, the primary cause of cervical cancer. In 2011, Rwanda launched a nationwide program to vaccinate adolescent girls against HPV.
They have a vaccination rate from over 90%, which is much higher than even most of the developed countries. And this shows the great engagement and the plan the Rwandan government has to address this.
Rwanda's economy has expanded quickly over the last 20 years. The current growth rate exceeds 7%. The healthcare system has improved dramatically too. Residents can go to health centres or to district hospitals if they need further treatment. Funding is provided through a health insurance scheme.
Health insurance is very important because it gives us access to medical care. It's difficult without insurance because medical bills are too expensive to pay on your own.
One of the healthcare system's showcase district hospitals is in Butaro. It's the only one with an oncology department. Women with cervical cancer can be operated on here. But even here in Butaro, the healthcare advances have their limits. Patients requiring chemotherapy and/or radiotherapy have to travel to neighboring Uganda. The downside of Rwanda's economic boom: more and more people are developing illnesses more typical of affluent countries. Non-communicable diseases such as cancer, hypertension and diabetes. These illnesses were in the spotlight at the World Economic Forum on Africa in the Rwandan capital Kigali in mid-May. They are putting an increasing burden on economies throughout the continent.
Now the problem is 80% of the burden of cancer is in emerging economies, and 5% of the healthcare spending dedicated to cancer is in emerging economies. So you see precisely the dilemma.
Cooperation with international drugs companies could be part of the solution. For example, in Kenya, Swiss pharmaceutical company Novartis offers discounted drugs to treat chronic diseases. The project could be rolled out in Rwanda.
The money would need to come from the procurement agencies in the public sector, from the countries, or from the procuring non-governmental organizations, or at one point in time, hopefully also from donors.
Rwanda's vaccination program against the human papillomavirus is an example of successful international cooperation. The scheme is organized by the state, which also pays for the vaccine costs. Merck has lowered its price to $5 per dose, 1/20th of the normal rate. The vaccine alliance Gavi negotiated the deal.
It's a teamwork. We had a great support from the Minister of Education that really, during the day of vaccination of a girl at school, do a special health day, and also to tell us who are the children not at school that day, so that we can reach them through the community health workers.
The dream of protecting an entire generation of women from cervical cancer is becoming reality in Rwanda. And the program could be a trailblazer for the rest of Africa.